Hello, I'm Laquesta Burak and welcome to Focus on Africa, our top stories. A police officer and a security guard in South Africa are facing murder charges after allegedly shooting a man accused of not following coronavirus lockdown rules. The Republic of Congo begins its lockdown tonight with real concerns about how the capital, Brazzaville, will cope.
For these people surviving day to day, self-isolation in their houses means they would be struggling to survive.
We report on the foreign athletes facing discrimination in East Africa because of the pandemic. Also in the programme, the heroes of the war on coronavirus. We look at the huge physical and mental challenges faced by nurses across the world. Hello and thank you for joining us here on Focus on Africa, coming to you from BBC World News. Well, let's start with the latest coronavirus developments from around the world. So far, there are more than 800,000 cases worldwide, with nearly 40,000 dead. Spain has suffered its highest daily death toll. To date, 849 people have died in the last 24 hours. It's the latest in a string of very high tallies as hospitals struggle to deal with thousands of patients. In the United States, President Trump has warned that America faces a vital 30 days in the fight against the virus and suggested that social distancing could save up to 1 million lives. Meanwhile, it seems that there is a glimmer of hope coming from Italy, the country worst affected by the pandemic. The number of people infected there has seen a sharp fall. Just over 1,600 new patients were diagnosed in the latest daily tally. Well, another warning today came regarding health services across Africa. This time, the International Committee of the Red Cross says that healthcare across the continent could collapse under the weight of the pandemic. There are now almost 6,000 confirmed cases with 175 deaths. Nearly all countries across Africa have reported cases and introduced restrictions on movement. But as the lockdowns take effect, there are concerns about how they're being policed. South Africa, for example, is on day 5 of a 3-week lockdown, and there have been reports of excessive use of force by security forces. The BBC's Vumani Mkeze reports from Johannesburg.
This is Alexandra, one of the poorest and most congested townships in South Africa. Social distancing is difficult to do at such close quarters, and there's a fear the virus could spread rapidly in places like this. The coronavirus crisis is highlighting the vast inequality that exists in this country. The wealthy are safer in their homes, and the poor are struggling to make ends meet. In the townships, it was a long wait for people trying to get their monthly social grant payments. 2 elderly people are reported to have died while standing in queues yesterday.
We're scared of being sick, but there's nothing we can do. What are we going to eat? We are here to get paid so we can buy the food.
There have also been long queues at the grocery stores, with customers waiting hours just to enter the shops to buy the basics.
We're all just trying, and we're all just implementing new different things as we see, as we go along. So I think most of the thing is educational. Education. We're learning every day also on our side, and when we're putting through that education onto our shoppers.
Townships such as Alexandra are difficult to police, and 5 days into the lockdown, there have been disturbing videos on social media of police and army brutality. Today, a police officer and a security guard appeared in a Johannesburg court accused of murder. The two are alleged to have shot a 40-year-old man in his yard. 4 others were also injured in the incident. President Cyril Ramaphosa has called upon law enforcement to show restraint and compassion while implementing the 21-day lockdown. Vumani Mkeze, BBC News, Johannesburg.
Now, South Africa isn't the only place where concern is growing over the policing of lockdowns. In Kenya, a 13-year-old boy was killed by a stray bullet from a policeman's gun as shots were fired to disperse a crowd. Ferdinand Omondi is in Nairobi for us. Hi there, Ferdinand. Now, we've got images of the 13-year-old boy being laid to rest, but what can you tell us about the incident?
Yes, his name is Yasin Moyo, and according to eyewitnesses and activists who we've spoken to, he was playing on the balcony of his home, which is in a place with low-cost houses near the slum, the outskirts of Nairobi, when police came into the area about 20 minutes after the curfew to disperse people, and apparently they used live bullets. They shot in the air, and the police inspector general says that he was caught by a stray bullet. He was taken to hospital, but unfortunately he died this morning, and under Muslim law he has already been buried, and that happened this afternoon.
And what's been the official line from the police or the government regarding the incident and generally policing of these lockdowns? There has been a lot of criticism.
There is a lot of angst in Kenya, Lucas, about the manner in which the police have handled this. There have been beatings, there have been tear gas, and now there are bullets. And today, the Police Inspector General ordered an immediate investigation into the cause of his death, and also ordered that a forensic examination be done on the firearms of the policemen who are patrolling that area. The Director of Public Prosecutions has also asked for the file of that investigations, of those investigations, as soon as they are completed. But there's a lot of people who feel that the government has been very half-hearted in its apology ever since on Friday. In fact, there's another incident in Mombasa where somebody also scammed from injuries apparently put in by the police. And the immediate reaction from the police spokesman then was that they regretted the incident, but that the people were not listening to instructions. And even the health minister himself recently said that the people should be humane, the police should be humane. But generally, the general feeling that the state itself has been very half-hearted and almost encouraged the actions that happened today.
Ferdinand, I'm just going to show viewers of some shots that we got from the Kisumu region. Again, you can see here that we've got a lot of gas that's around the Kisumu area. But what I want to ask you about is some news that's come to us from the International Committee of the Red Cross. They're warning that healthcare systems in Africa could collapse. Tell us about Kenya's capacity.
Well, at the moment, Kenya has about 120 ICU beds, the isolation facilities, specifically for COVID-19 at the Mbagathi Healthcare Hospital. The government says it's trying to put up another 300 at the Jomo Kenyatta University hospital, but that's just about it. Luckily, right now, it appears that Kenya is already managing, but a huge concerns. Government projections itself says that if it breaks out, then Kenya could have as many as 10,000 cases by the end of April. As at now, Kenya can only do about 300 tests a day. So there's a huge risk of it getting to disastrous proportion, especially if COVID-19 gets into the slums where people cannot practice social distancing and do not even have access to water to wash their hands.
Okay, Ferdinand Omondi in Nairobi, thank you very much indeed. Thank you. Well, let's turn our attention to the Republic of Congo, which has so far reported 22 confirmed cases. And from tonight, there's going to be a 20-day lockdown and also a nighttime curfew. Now, the measures were announced on Saturday. They sparked alarm in the capital, Brazzaville, and thousands were seen to have left the city to try to return to their home villages. But for those who've had to stay on, there is real concern about access to food and supplies. So from Brazzaville, here's the BBC's Rosemarie Bubutu.
For most Brazzavillians, staying locked down in their houses in the capital would be a challenge because most neighborhoods are subject to frequent power cuts and water shortages. Most Congolese live below the poverty line, and for these people surviving day to day, self-isolation in their houses means they would be struggling to survive. Food prices on the markets have soared. Eyewitnesses told me that the bag of cassava flour, a staple food for most Congolese households, usually costing $70, is now up to $120, a 30% increase. Now, the government did announce a support fund to help the businesses and individuals affected by the lockdown, but it is still unclear how the 168 million will be spent. But now, with this massive movement of people out of the capital city, Congo is at threat of the coronavirus disease spreading into remote areas of the country.
That was Rosemary Bobertu speaking to us from Brazzaville. Time for us to take a quick look at some other developments across the continent. And Uganda's President Yoweri Museveni has announced a raft of strict measures over the next 2 weeks to stop the spread of coronavirus. In a televised national address on Monday evening, he announced a ban on private vehicle use, meaning anyone needing emergency medical care will need to ask a high-level district official for permission to leave their home. Meanwhile, in Ivory Coast, authorities have launched an operation to disinfect the country's largest city, Abidjan. It comes after the country's first recorded death of coronavirus. Currently, 180 people have tested positive for the virus. Last week, President Alassane Ouattara declared a state of emergency and introduced a nighttime curfew. Ethiopia's general election is set to be delayed due to COVID-19. They were due to be the first multi-party polls since Prime Minister Abiy Ahmed lifted a ban on opposition parties and dissolved his ruling party. The elections had been due in August. The former president of the Republic of Congo has died in Paris after testing positive for COVID-19. Jacques-Joachim Yombi-Opango led the country from 1977 until he was toppled from power in 1979 by the country's current leader. His family said Mr. Yombi-Opango, who was 86, had been ill before contracting the virus. Now, as infections worldwide continue to rise, concern over the pandemic has led to a growing number of incidents of discrimination in some parts of Africa. From Ethiopia to Kenya and the Democratic Republic of Congo, foreigners have been verbally and at times physically abused over fears that they may be infected with COVID-19. The BBC's Emmanuel Igunza reports on this worrying trend.
This is Iten, known as the home to Olympic and world champions in athletics. Over the decades, this western Kenya town has produced more world record holders than any other part of the country. It's little wonder that hundreds of local and international athletes have made this famous town their training ground. But that stellar reputation is under threat. Recent weeks have seen foreign athletes verbally and physically attacked by locals who accuse them of being infected with coronavirus. Spanish conditioning coach Toti Kobalan was the first to go public after he was pelted with stones and called coronavirus during a run in the Kenyan town. At least 4 other athletes have told the BBC they have gone through the same harsh treatment, including a Swiss athlete currently training in the same town.
I've been called corona and some other people that I know are a bit distant. But I respect that because maybe they fear, and I think it's just a period and things will get better soon.
Some of the international athletes training in Iten are now opting to go out in groups and in the company of local athletes to avoid being targeted. It's something that elite athletes in the region have strongly condemned.
Maybe the children lack some education, or maybe the perception that they received from maybe the elderly took it in negatively, and they perceived as if the white people are the one having corona and maybe the blacks don't have it.
But these are not just isolated cases in Kenya. Across Eastern Africa, foreigners have reported being attacked over COVID-19 fears. In March, Ethiopian Prime Minister Nobel Peace Prize winner Abiy Ahmed appealed to Ethiopians not to target foreigners. This is after the US Embassy issued an alert to its citizens living there after some Westerners were stoned, chased and spat at due to panic over the spread of the disease. In the Democratic Republic of Congo, an aid worker who didn't want to be identified told the BBC foreigners working with humanitarian agencies had been forced to relook at their security arrangements after several of their convoys were pelted with stones. Back in Iten, Alex Jodido has a special message of unity in what he describes as a difficult time for the entire world.
I think it's sad, but I also understand Kenyan with the situation that we have in our country, and I think we should just stay all calm, hakuna matata, and be together in that situation.
Emmanuel Gunza, BBC News, Nairobi.
Now in Egypt, there are dozens of Sudanese citizens stuck without a route back home as both countries agreed to shut borders in response to the coronavirus pandemic. Families have been left to fend for themselves with no idea when they'll get home, but locals from one Egyptian village are trying to help. Daniel Henry has more.
In a small Egyptian village, hundreds of stranded Sudanese nationals are offered a hot meal.
When the Sudanese called for help, we came at once. There are more than 1,200 people stranded and in need of food and water.
When the coronavirus crisis led to Sudan's government calling for a lockdown, some citizens found themselves locked out as the borders between Egypt and Sudan were declared shut until further notice. They say they've been stuck here for 3 weeks. Some came to work, others to study, but locals are doing whatever they can to support them. While the hospitality is clearly appreciated, what these families really want is to go home. Right now, they don't know when that will be. Daniel Henry, BBC News.
You're watching Focus on Africa, coming to you from BBC World News. Do stay with us, because still to come, a new message of hope on an ancient monument. Now, the crisis has impacted every part of our lives. We're being told to stay at home, but what if you're still searching for somewhere to call home? Well, on the islands of Greece, 35,000 refugees and migrants are staying in facilities that were built for just a fraction of the number. In Lesbos, cases of COVID-19 are climbing. The BBC's Stephanie Hegarty was sent footage by a group of young filmmakers living in the migrant settlement of Moira on the island, and they spoke to people there who are doing their best to keep others safe.
Wash your hands, we're being told. Keep surfaces clean. Use hand sanitizer. Stay 2 meters away from each other. But how do you stop coronavirus in a refugee camp? Refugee and migrant camps are a ticking time bomb for a coronavirus outbreak, and very few of them more so than Moria in Lesbos in Greece, where 18,000 people are living in a facility that was built for 3,000. We can't travel to Moria. Greece has a quarantine in place for visitors, and we don't want to risk bringing the virus there. But a group of young filmmakers have sent us this footage.
Here are some water taps. There's no water inside it. There's no water.
Yasser is 18. He's been here for 5 months.
Here, and the trashers are right next to them, so it's disgusting. There is few hours that people have access to water, and at that time it's overcrowded, and there's so many long queues to use the water, and there's also some other toilets, same as the previous ones, are not as usable, and people have no good access to doctor because about the crowding, and they have no access to gloves, masks to prevent themselves of virus corona, and that's it.
While the rest of Europe is being told to stay home, people here have to crowd around a truck to get a limited supply of drinking water every day. They have to queue for food. And like everywhere else in Europe, the shops in the island of Lesbos are running out of soap and cleaning products. That shortage will hit the camp hard.
And this is the shower of the men, and as you can see, it's really dirty. Waiting in the long queues for taking the shower. And here is dirty, same as the shower.
A small group of people living here are doing whatever they can to try to prepare for an outbreak. Dean Mohammed is a pharmacist from Afghanistan. The WHO says cotton masks aren't very effective, but at least it's something.
So this is our factory, and these are our volunteers. Hello guys.
There are no cases in the camp yet, but Médecins Sans Frontières, who are working here, are preparing for the worst.
Do you worry that when, as governments are dealing with this pandemic, that refugees or migrants might be left behind?
Yes, that's the big worry. If people are becoming sick, we know they should be in self-isolation, and this is just impossible in Moya. So it's the worst setup that you could have, and if the outbreak starts in Moya, it's going to be extremely difficult to contain.
The Greek government say they're setting up isolation containers, but MSF worry it's not enough. They're calling on the government to evacuate sick and elderly people to a place with better health facilities. Meanwhile, people here do what they can to keep the virus out. Stephanie Hegarty, BBC News.
Now, the BBC has learned that medical staff around the world are facing unprecedented physical and psychological challenges as they continue to battle the pandemic. The International Council of Nurses says that their 20 million members need to be properly shielded, and they're calling for an urgent increase in the supply of protective equipment. Tulip Mazunda reports.
The women and the men on the front line of this global battle. All over the world, they are putting their lives at risk to protect ours. China was the first country to face the full force of COVID-19. South Korea followed soon after. Health workers have been sending us videos from their clinics from all over the world.
When caring for patients, we must wear full body protection. 2 layers of overshoes, gloves, masks and goggles. In 5 minutes, the whole body is drenched in sweat. It becomes hard to care for patients.
The US is the latest country to be hit hard by this pandemic, with more cases now than anywhere else in the world. Europe has been at the epicenter of this outbreak for more than 2 weeks now. Here in eastern France, the military have set up makeshift critical care facilities. The Italian health system is overwhelmed, patients now being admitted into massive tents.
We are at war with a totally invisible enemy. We are fighting for everyone and trying not to get hurt ourselves. We feel like we are the spearhead in this battle.
Our efforts are not awarded with a positive outcome sometimes. Another issue is the interaction with the family member. The contact is mediated by phone, and often we receive calls asking for updates. They never can see their relatives, and it's start to express with words how much pain and suffering we can perceive throughout the voices on the other side of the phone.
All this as the world faces a chronic shortage of crucial personal protective equipment for health workers. The World Health Organization estimates that globally the response requires around 89 million medical masks and 76 million gloves each month.
As always, nurses are stepping up, they're saving lives, but they're putting themselves, often sacrificing themselves ahead of other people. That is not possible to continue in the long term. And if we don't properly look after our health workforce, after our nurses, if we exhaust them, my fear is that this will make the virus worse.
There is no global tally of the number of infected healthcare workers. In China, the government says more than 3,000 have been infected and at least 22 medics have died. Spanish officials say around 13% of all those infected are healthcare workers, which would mean more than 10,000 have caught the virus there.
That was Tulip Mazunda. Now, with all of us in lockdown or social distancing, there is a bit of a need for something positive. And nothing comes more impressive than this. Take a look. Now, this is Egypt's famed Great Pyramid in Giza, which was lit up last night with a huge thank you to all nursing and medical professionals, reinforcing also that important message to stay at home and to stay safe. Fantastic images coming to us there from Egypt. From all of us here on Focus on Africa, we will see you tomorrow. Stay safe.